Arava is a medication used to treat rheumatoid arthritis, a condition where the body's immune system attacks healthy tissues around the joints. This medication helps reduce joint damage, pain, and swelling, allowing for improved movement. It works by weakening the immune system and decreasing inflammation. The recommended daily dosage of Arava is typically 1 tablet taken once a day. It is best to take it at the same time each day to maintain a consistent level of the medication in your body. It is important to follow your doctor's instructions and take Arava exactly as prescribed. It's important to take Arava exactly as prescribed by your doctor. You may be instructed to take a higher dose for the first 3 days of treatment. The dosage is based on your medical condition and response to treatment. Take this medication regularly at the same time each day to get the most benefit from it. If you need to stop taking Arava, your doctor may prescribe a different drug to help remove it from your body. This is especially important if you are planning to have children or are experiencing severe side effects. Make sure to consult your doctor or pharmacist for more details. Remember to tell your doctor if your symptoms last or get worse. If you experience diarrhea, nausea, or dizziness, it's important to let your doctor or pharmacist know. Keep in mind that the benefits of taking this medication are considered to outweigh the potential side effects. However, it's essential to monitor for any serious side effects, such as cough, numbness or tingling in the hands or feet, hair loss, chest pain, rapid or pounding heartbeat, increased thirst and urination, muscle cramps or pain, changes in mental or mood, changes in vision, easy bruising or bleeding, unusual growths or lumps, unexplained weight loss, or unusual tiredness. Additionally, it's important to regularly check your blood pressure, as this medication may raise it. Be sure to inform your doctor if you notice any high readings. Also, be aware that this medication may lower your ability to fight infections, so it's important to seek medical help if you experience signs of infection, such as a persistent sore throat, fever, swollen lymph nodes, or chills. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. Leflunomide can commonly cause a mild rash, so it's important to seek medical help if you develop any rash, as it may be a sign of a severe allergic reaction. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. No need to report side effects to the FDA or Health Canada. It is very important to not use leflunomide during pregnancy, as it can cause serious harm to an unborn baby. Before starting this medication, women of childbearing age must have a negative pregnancy test and use reliable forms of birth control. Even after stopping the medication, they should continue using birth control until they have finished taking another drug that helps leflunomide leave the body, and have confirmed through 2 blood tests that the leflunomide levels are very low. This medication may rarely cause serious liver disease, which can be fatal. It is important to note that if you already have liver disease, such as hepatitis B or C, leflunomide should not be used. Liver function tests must be performed periodically while taking leflunomide. If you experience symptoms such as nausea/vomiting, dark urine, light-colored stools, stomach/abdominal pain, or yellowing eyes/skin, you should inform your doctor right away. Before taking Arava, make sure to inform your doctor or pharmacist if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. You should also discuss your medical history with your doctor or pharmacist, especially if you have any immune system disorders, infections, cancer, kidney or liver disease, alcohol abuse, heart disease, high blood pressure, or lung disease. Arava may cause dizziness, so it's important to avoid alcohol or marijuana, as they can make you even more dizzy. It is also advised not to drive or use machinery until you can do so safely. Avoiding alcoholic beverages is also recommended, as alcohol may cause liver disease. It's important to avoid immunizations or vaccinations without the consent of your doctor, and to stay away from people who have recently received oral polio vaccine or flu vaccine inhaled through the nose. Arava can make you more susceptible to infections or worsen current infections, so it's best to avoid contact with anyone who has an easily spread infection, such as chickenpox, COVID-19, measles, or the flu. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication should not be used during pregnancy, as it may harm an unborn baby. Women of childbearing age must have a negative pregnancy test before starting this medication, and both men and women must use effective forms of birth control while taking Arava. It is not known whether this medication affects sperm, so men wishing to father a child should consider stopping the medication and using another drug as directed to help Arava leave the body before attempting to conceive. This drug may also pass into breast milk, so breastfeeding is not recommended while using Arava. It's important to be aware of the potential interactions Arava may have with other medications. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Arava include warfarin, drugs affecting the liver, cholestyramine, and other drugs that weaken the immune system. Additionally, do not take teriflunomide, used to treat multiple sclerosis, while you are taking Arava. Remember to keep a list of all the products you use and share it with your doctor and pharmacist. This will help ensure the safe and effective use of Arava. If you suspect an overdose or experience severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. This can be done by calling 911 or contacting your local poison control center. U.S. residents can call 1-800-222-1222 for assistance, while Canadian residents can reach out to their provincial poison control center. It's important not to share Arava with others. Before starting this medication, you may need a skin test to check for tuberculosis. While taking Arava, you may also need to have regular lab and medical tests, such as liver function, blood counts, and blood pressure checks. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Arava, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. It is important to store Arava at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of Arava, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.